For Action News, I'm Anna Dulosky. A new study on children's emergency room visits finds almost 10,000 annual cases of drug-related exposures result from toddlers getting into parents' medications. Commonly ingested pills include blood pressure medications, pain relievers, and tranquilizers like Valium and Xanax. But whatever they are, the key question is, how are they getting into the little ones' hands? Action's Dr. Gilbert Ross says this is unacceptable and parents are to blame.
Toddlers of that age, once they start moving around, will find and get into anything they can get their little hands on. This is why new parents, the first thing conscientious, responsible parents do is childproof all of their closets, all of those nasty bottles of things under the sink. They also ought to watch their medicine cabinets. Kids get into packages of medications, bottles, even single pill containers, and they're very clever at extracting them somehow. It's funny how older people have trouble opening childproof bottles, but little ones often have no trouble at all, which is ironic and can be disastrous. It's not so important what the nature of the pill is, frankly, although the article goes into great detail about which pills are most commonly ingested. The painkillers, blood pressure medications, tranquilizers, the benzodiazepines like Valium and Xanax. Whatever they are, kids should not be ingesting them. Even if they're placebos, it shouldn't be around for kids to get into. So the medication should be kept out of kids' reach. Unfortunately, what you think kids can't reach is not always exactly true. Medication should always be put away. You should seal that childproof bottle and make sure you hear it click tight. You should educate kids about what they're allowed to touch and what they're not allowed to touch. I should say, though, that other household poisons are not thought of necessarily. They're not medications, but things like detergents, bleach, dishwashing liquid, those little packets that you put in the dishwasher. They can look very attractive to a kid. Cosmetics, perfumes, deodorants, anything that a kid will get their hands on if they're young enough, especially if it smells pretty, they'll try to eat it. So all of these things, not just medications, but any potential toxin in the home, and almost everything can be toxic if a kid gets their mouth around it. Parents have to be responsible, keep their eyes on their kids, keep these substances out of harm's way, and talk to kids about what they're absolutely not allowed to touch. And that's the message of this article, and it's always worthy of bringing to the attention of everybody.
To read more on this study and others, you can head to our website, action.org. And while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Anna Dulosky.